Welcome to the SABC News COVID-19 Global Wrap. I am Busisiwa Khadebe. This week, I bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. But before we delve into that, let us have a look at some global stats. The world currently sits at over 49 million confirmed cases, with more than 34.9 million recoveries and over 1.2 million deaths. South Africa's coronavirus infections stand at over 732,000 confirmed cases, with over 671,000 recoveries and over 19,600 deaths. In South Africa, Western Cape Premier Alan Winde has called on residents to remain vigilant and continue to adhere to COVID-19 safety protocols in order to prevent a second wave of infections. The province reached the peak of its first wave of cases in July, and case numbers and fatalities have continued to stabilize since then. Meanwhile, the resurgence of coronavirus infections in the Nelson Mandela Bay Metro in the Eastern Cape over the past 2 weeks has reignited concern among schools in the municipality. The metro currently has more than 3,500 active cases, up from 400 2 weeks ago. On to the rest of Africa, the continent has now recorded over 1.8 million confirmed COVID-19 cases, with over 1.5 million recoveries, with the death toll at 44,316. Kenya's President Uhuru Kenyatta has extended the country's night curfew to January 3rd as part of measures to contain the spread of COVID-19 after numbers surged in October. And lastly, the European Union has agreed to provide Mozambique with 100 million euros in coronavirus-related aid, EU Ambassador Antonio Sanchez Benedito Casper said on Monday. The EU cut off direct budget support to Mozambique in 2016 after the country revealed the existence of hefty state-guaranteed loans that it had not previously disclosed. And in international news, a World Health Organization-led scheme to supply COVID-19 drugs to poor countries is betting on experimental monoclonal antibody treatments and steroids. It is, however, shunning Gilead's remdesivir blockbuster therapy. According to a WHO draft document seen by Reuters, the priorities are to secure monoclonal antibodies in a tight market. The aim is also to boost purchases and distribution of cheap steroid dexamethasone. In the United States, the number of coronavirus patients in hospitals breached 50,000 on Tuesday, the highest level in nearly 3 months. Texas reported the highest number of currently hospitalized patients, followed by Illinois and California, according to a Reuters tally. While California has 3 times as many people as Illinois, new cases have been the highest per capita in the Midwest. Nationally, the number of hospitalized COVID-19 patients rose over 64% since October 1st, threatening to push the country's health system to the edge of capacity. In Asia, mainland China denied entry to some travelers from Britain, where most people have died from COVID-19 than anywhere else in Europe, in a partial closure of its borders this week again as new coronavirus cases fled around the world. Because of the pandemic, China has temporarily suspended entry of non-Chinese nationals living in the United Kingdom, even if they hold valid visas and residence permits. Starting on November 6, all passengers from the United States, France, and Germany bound for mainland China must take both a nucleic acid test and a blood test for antibodies against the coronavirus. The test must be done no more than 48 hours before boarding. For the latest updates on the coronavirus, visit sabcnews.com.